How could the shift to MECQ affect the country's health sector, especially as cases continue to rise? To answer that, we have with us Dr. Ong-Lim, member of the DOH Technical Advisory Group. Good evening, Dr. Ong-Lim.
Good evening, Robbie.
Let's start with what's on the minds of many Filipinos. Tumaas ang numbers, nagulantang sa 17,000 plus. This on the day or the day after we receive word that we're going back to MECQ. It really seems very ironic, counterintuitive. How are you looking at this?
Well, it's certainly very concerning. Maybe for a little bit of a perspective, the discussions were done a few days ago. And of course, these numbers were not yet on the table. But even then, I think one of the things we have to keep in mind is these numbers are a reflection of what happened 2 weeks ago. This was precisely why we closed down. We were expecting these numbers to come up. So the actions that happened or the result of the 2-week ECQ is something that we will be seeing 2 weeks down the line. There is always a lag time that we have to consider. I think one of the big differences that we're seeing with respect to the numbers is that even as there is a higher demand for hospital services, comparatively, in contrast to what we experienced in March or April, there are fewer ICU admissions. And it seems that the healthcare capacity is faring up a little bit better this time around. Of course, without minimizing the demands on capacity, it's still quite substantial.
Okay.
So I think we have to keep a really close watch to see where these numbers go. And the team meets quite regularly to assess. And hopefully, if there's any indication that there's a need for tighter quarantine, I'm sure this will be discussed.
Doctora, given the 2-week delay in assessing, I mean, as you said, this is actually a snapshot of what happened 2 weeks ago. We've been on a 2-week lockdown. Does that actually mean we still don't actually know if the 2-week ECQ, what the impact of that was?
Well, there are projections, and the reason why the ECQ was implemented in the first place is that we expect the numbers to go down. But we all have to admit that this ECQ is actually not what we expected. I think I personally didn't expect this much movement to be happening, because what I had in mind was an ECQ that was similar to what we experienced last year. And that's simply not happening anymore. So I think one of the things we have to also think about is how do we achieve the limit in mobility that ECQs are supposed to achieve to be effective.
Okay. Maraming salamat po, Dr. Ong-Lim, member of the DOH Technical Advisory Group.